So today's MCQ is during ligation of inferior thyroid artery in thyroid surgery. Most likely the structure injured is external laryngeal nerve, internal laryngeal nerve, recurrent laryngeal nerve, or sympathetic chain. To understand this question, we first have to understand this diagram. Here we see the posterior aspect of the thyroid gland. These are the thyroid glands. So here we can see the arch of aorta, from where we are having the subclavian arteries on both sides, and here is the yellowish color is the vagus nerve, and from the vagus nerve we can see the origin of recurrent laryngeal nerve on both the side. On the right side, the right recurrent laryngeal nerve winds around the right subclavian artery, whereas on the left side, the left recurrent laryngeal nerve winds around the arch of aorta. Basically, the left recurrent laryngeal nerve has a longer course and is more towards the midline in compared to the right recurrent laryngeal nerve. So this is the question. Left recurrent laryngeal nerve is more longer and is more towards the midline in compared to the right recurrent laryngeal nerve. We can remember L for left and L for long. Another thing is here the relationship of the nerve with the artery. The recurrent laryngeal nerve is mostly is related with the inferior thyroid artery. Here you can see the inferior thyroid artery on both sides. It is arising from the subclavian artery. Above we can see the external laryngeal nerve on both the side, and it is related to the superior thyroid artery on both sides. Superior thyroid artery takes its origin from the external carotid artery. Now going to the main concept. Superior thyroid artery is related to the external laryngeal nerve, as we have seen in the figure, and inferior thyroid artery is related to the recurrent laryngeal nerve. Now what will happen if they are injured? One is the anatomy question is this, and what happens when they are injured is the next question. So whenever the external laryngeal nerve is injured, there is loss of pitch of voice, and whenever recurrent laryngeal nerve is injured, so it varies if it is unilateral or it is bilateral. If it is unilateral, there is hoarseness of voice, but if there is a bilateral, then airway obstruction is the main symptom. And another thing about the anatomy, as I have already told in the figure, which is asked, is about the right and left recurrent laryngeal nerve. Left recurrent laryngeal nerve is longer than the right recurrent laryngeal nerve, and left recurrent laryngeal nerve runs towards the midline in compared to the right recurrent laryngeal nerve. Another question which is mostly asked in the NEET SS is the Cernia classification. Cernia classification tells us about the relationship of external laryngeal nerve and superior thyroid artery. It has three aspects. It is 1, 2A and 2B. In 1, the external laryngeal nerve goes more than 1 centimeter above the plane of upper pole of thyroid, whereas in 2A it goes within 1 centimeter of the plane of the upper pole of thyroid. In 2B it goes below the plane of the thyroid. So going back to our question, so here goes the answer as a recurrent laryngeal nerve, as inferior thyroid artery is related. Another question which is asked, which is the most commonly injured nerve during the thyroid surgery? The option remains the same. Please answer this question in the chat box.